over at Garvin Elementary, and she kind of serves as a CTA liaison. So we always make sure that the union's aware of what we're doing in policy. We get their feedback. It's been invaluable over the last few years. I also want to take this opportunity to wish Dr. Santa a very happy birthday. Thankfully she is here on her birthday because obviously you have no place else better to be.
Well, I thought bloodborne pathogens, tuberculosis, and immunizations would be fantastic topics to talk about on your birthday.
Yes, a TB birthday. All right, so first order of business will be the approval of the agenda. Item A is the compliance with the governor's executive order 20-103, dated December 8th, 2020. Discussion and or vote whether there is public access to the meeting through adequate alternative means. Mr. Chandler?
There is.
And so we just need to vote on that. I would ask for a motion to approve.
Motion to approve.
I'm
I'll
sorry, who's that?
second.
Okay, Feather.
Feather.
AF.
We're gonna have to go Feather Smith.
That's right. All in favor?
Aye.
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 That approves 3-0. Next up is the approval of minutes from 10/20/2020. A long time ago. I know you ladies were not here, but of course you can help to approve the minutes from that meeting.
Mark, I have a question about that. I
Yes.
was looking in the drive and I don't know whether or not that folder has been shared with me. Is that
I cannot answer
Right.
that question.
okay?
That is a Mike Chandler question.
Which folder is it?
Like, the policy folder.
I'll double check now.
Thank you.
When you went to Google, when you went to the drive under school
Yep.
committee docs, is it listed?
If I were to just search and drive,
Yeah, I'll take a look and I'll send you a
is there?
link or
Okay,
whatever
sorry.
it is.
Yeah. So,
Yep.
Thank you.
Yeah, because what you'll see is the meetings, school committee meetings 2021, and then you'll go into that, and then you'll see the policy meeting for tonight. And inside that drive, there'll be all of the policies, the agenda, the minutes.
Okay.
If you just searched in Drive, you might be pulling up like my policy folder that
Right.
like I work with drafts and stuff. So, but I would
Yeah,
happily share it with anybody who wants to look at it. It's very interesting.
Thank you. Thanks. So, okay, so we can continue with the agenda. I just wanted to ask.
Okay, so I just need a motion to approve the minutes.
I'll motion.
You'll motion?
You
Carrie,
said I haven't-
you're muted. I don't know.
I apologize. Yes, I will second.
Okay. This will make the meeting minutes very easy because I'll just be able to cut and paste Carrie Feather, Carrie Smith. Okay,
Yeah.
all in favor? Aye.
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 3-0. So the next up is the discussion of B1, the school committee policy approval process policy. I put that on specifically just so that we can kind of talk about the way the meetings will run, the way that we create policy, amend policy, all of that stuff. Essentially what will happen is the administration will come to me with concerns that they have, or I will go to them with concerns that I have regarding policies that we do not have, policies that are just old, or there are policies that we need to review every so often. And that's kind of the way we do it. Although we will make amendments to policy drafts in these meetings, we don't do a lot of the actual policy work in these meetings. I tried that a while ago, a couple of years ago, and it really got us nowhere. So a lot of times what I'll do is I'll be working with Katie Duncanson, I'll work with Rachel, Tony, Bob, whoever or even Mike Chandler, depending on what topic it is that we're trying to address. And I do a lot of the research, and then usually I'll meet with the administration. But if there are any times when you guys feel that there's a policy that needs to be looked at, or you have concerns about something, definitely we'll put it on the agenda so we can discuss it. Is there do you have any questions at this point right now about this? And actually this policy, as I was reading through it, definitely needs, I think, an updating. There's just some language in it I don't like, and we'll probably deal with that at some point. Because one of the big things we're going to be doing over the next few months is also reclassifying a lot of policies. I think there are a lot of policies that are in different classifications that really should be in different classifications, which is how we ended up with tuberculosis, because I noticed it was in the student section, not the personnel section. And then that led to a whole medical put doors box. So any questions? No? All right. We'll move on to the next topic, which is discussion and or vote to approve amended policies J2 attendance. That was worked on by Katie. I think Tony had a hand in that, as well as Rachel. Rachel, were you involved in that one too? It helps if you're unmuted.
Rachel did have input
I
on
got
that.
it. Yeah, I read through it. I don't think I attended that particular meeting, but yeah, that Tony and I worked on that a little bit with, as well as Katie.
Okay,
I
so
know
I'll
I
let Katie
definitely
take over
reviewed
the
it.
discussion. This is really just about COVID language that we tried to do in last fall, but weren't able to get it done. Katie?
Right. So I apologize in advance if that sounds like there's an elephant like parade behind me. There's children that are eating dinner. I haven't done any work on this since I believe it was late July, early August, maybe, that we talked about this last. And then it kind of, there was a request to table it by the last subcommittee group. But it really was being proposed to be amended to account for COVID related absences. And it also, there was some concern from staff about, from the nursing staff specifically, about doctor's notes and absences related to that. So we were trying to address that as well. And so it really allows a parent to excuse illness absences for up to 2 consecutive school days. And then a doctor excuse illness or injury for absences extending to 3 or more consecutive school days. So I believe it was doctors needed to provide notes for really any absence, sick related, and that was amended. Am I correct with that? So we amended that to the definition of excused absences. And then in the last part, it allows for a parent note for a personal illness in anticipation that there would be more because of the screening process that students are required to do before. But it does still require a doctor's note for 3 or more absences in a row. And then I believe that's it that I saw.
There's the part on the Virtual Learning Academy, which, do we need to change that language, because that language was changed?
That I think was what put it into the tabled category. Hold on. Oh, yes.
So what should that read? Just instead of Virtual Learning Academy, distance learning?
Exactly. That's all it is a full distance learning model, full-time distance learning model.
So Tony, since this is your ballgame with this, should it be 2020, 21, 20, I'm sorry, a lot of 20s, 2020-2021 school year distance learning? Just
yes, it should. It should read that, because we don't know going into beyond this, the end of this year, what that model will look like.
all right. So what that'll say is, and then later in that paragraph, it also talks about the Cumberland Virtual Academy. We'll just go with distance learning model. Should we say model, or just
I would say
leave it?
full-time. It's full-time distance learning model. Mhm. I think it's important to note that it's full-time, that they're attending it.
Well,
every
that's
day.
in case.
Well,
That's in
I have a
case
question.
if the family is quarantined, then they can't come to school, but they can participate in the distance academy, or they can learn remotely, so they don't get marked absent. They would be marked
Right, they have
DLT
access
instead.
to the streaming, right?
Carrie?
I have a question. Yeah. So,
Rather?
yeah, I'm wondering if it's almost 2 separate things, right? So we've got the School Year Virtual Learning Academy, And, it outlines, folks who can't come to school because of, well, I think we're trying to cover both things in this one paragraph. Students who can't attend because they're quarantined or whatever, but also students who are distance learning full time. Do we need to split those up? Because
Same.
it's, so I'm thinking my case, my kids are home. My kids are doing distance learning 100%. So, for them, if they're sick, they're still on their computer. But for students who are quarantined, typically in school, are we saying that, they can't attend school due to the household sickness or yada, yada, yada? And, maybe we should split that up a little bit just so that it's more clear.
I think you could add just in person, so students who cannot attend school in person, and then that should cover it. I think when you separate it out to the two groups, you're going to end up having a 5,000 page policy manual.
I agree. Yeah. So
yeah.
I just needed clarification in there about,
In
just making
person.
sure we were separating.
Yeah.
Yep.
I agree.
because
Cool.
I have one that's full distance and I have one actually in the virtual academy. So,
Right. Because I think that virtual academy was the initial idea prior to hybrid.
yeah,
Right.
yeah. So, and we still have it for certain students. So I just need a motion to change that language.
I'll motion to change.
All right.
I
So,
will second.
and the language will be, Katie, can you just,
So it will read, for the 2020-2021 school year, students who cannot attend school in person due to personal or household sickness shall not be considered absent on days in which they cannot attend school in person, so long as they participate in their assigned distance learning. This may consist of classroom curriculum or participation in Cumberland's full-time distance learning model. A doctor's note shall not be required for students' absence who is participating virtually. Can I add one?
what would you like it to be?
Just, I don't think they need a doctor's note, but I would like some sort of documentation. The Department of Health, now that we've been living this for almost a year now, we now know that there is some documentation that comes with an exposure or positive, that you get a test or what have you. Just so, because otherwise I do think it will cause some problems for chasing for attendance, but I'm open to discussion on that.
Thinking that part through, are there times where students might be, kind of unofficially quarantined or no? Like if they know that they've been exposed to someone?
So there's times where there's a gap between when they've been contacted by like their friend or something who has tested positive, and the Department of Health has contacted them. So there's a gap between, and sometimes the Department of Health never contacts them.
Right.
But I think documented makes a phone call to the principal or whoever necessary, whereas without that language, anyone could really claim to be continually quarantined.
Yeah.
And I know that Rachel had concerns about some students coming up with a lot of excuses to not come to school.
Do we have
Got
to
it.
worry about language with this though, and with HIPAA or anything, to say the reason that they're ill? Because if it's for a quarantine purpose, are people going to say they don't need to share that information? That the doctor should just say they're out for illness or something? I just don't know if that's going to cause any issues with any parents saying that impedes upon their HIPAA.
So if they're asking to be excused, HIPAA does not apply to public schools in that sense. We're not medical personnel. FERPA applies to us, but HIPAA does not. So we don't have the same restrictions. But if they're asking to be excused from school there's an obligation, an affirmative obligation to provide documentation.
Cool.
Okay, so we do want to put something in there as relates to quarantine and documentation.
Right. So what language do you want to use, Katie?
So just the first sentence would be changed for the 2020-2021 school years. Students who cannot attend school in person due to documented personal or household illness.
Okay, just documented. So you're just really adding that word. All right. So what we need is we need to have a motion to amend.
I'll motion to amend as Katie stated.
Okay. And then Mrs. Feather, you will second?
Second.
All in favor?
Aye.
Aye. The amendment passes 3-0. Now we need to actually approve the policy. So who wants to make that motion?
I'll motion. Feather.
Feather, Mrs. Feather.
I actually would like to have one more read through once all the amendments are all done before
Sure.
voting.
Absolutely. Katie, would you like to, you have the language. Can you read through the whole thing?
The whole policy or just that?
No,
language?
just that section
Yep,
that
sure.
that we've amended.
Namak, I'm sorry, I apologize. I just would like to see it in a clean cut version before voting on the whole. Because the whole policy is what we're going to have to vote on as amended, if that's
Okay.
correct.
Did you you mean the
So-
section that we just changed or the entire thing?
The section that we just changed, I understand it, but I'd like to see it put into the whole document and read through before giving a final vote.
So here's what I can suggest. I am not heavily involved. Rachel, Dr. Santa did most of the work on the immunization. I can actually modify the Word version and then present it. Would that
That would
to
be
the group?
That would be good.
All right. So if you want to just.
What we can do is we can just vote on the amendment.
Yep.
And then we can
Yeah.
send it to the full committee for Thursday and then have the finalized version voted completely on Thursday.
Yeah,
Or
that
I
would be
can,
perfect.
or after you're done with the immunization, I can just quickly present it and then you vote on it to go to the,
I like that idea too.
Okay, all right, that's good. Thank you.
so I
All
can
right.
work on that right now.
So we'll just leave it, we'll leave the first and the second for discussion and we'll leave it there for now. And we'll just move on to G4 and J11. They're the same policy, bloodborne disease. Rachel, those are exactly word for word, correct?
Yeah, they're exactly word for word, but they are a diversion from the original policy.
Yeah.
The problem with policies is once you start to work on them, it's like going down a rabbit hole. You start to look at things and change things. So there's a couple things in this particular policy that I highlighted specifically because of either one, I'm unsure whether or not we have these policies within the same building, or two, I was wondering whether or not they actually should be in our policy, even though they may be in the state policy. So this policy it's a little bit different than some of the policies I've seen because it's based on the Department of Education and RIDO, Department of Health, working together to create a policy, and was initially created when there were more AIDS cases and there was lack of information about AIDS and a lot of hysteria about kids being in school. So when you understand, we all know that kind of history, that kind of was what was the impetus for writing this policy. A lot of this is the same from the original policy, but what I noticed glaringly that was missing was universal precautions. And it's very, very clearly stated in the original policy, in the original state and Department of Health policy, but was omitted from the Cumberland policy. And we do review, as regulated, we do review those universal precautions once a year. All the teachers are required, all the staff are required to watch a bloodborne pathogen and universal precaution video and sign up that they have seen it and they've read the policy and things like that. So, I'm not exactly sure how you want to approach this, Mark. I definitely think we need to talk about the things I highlighted because there's some things in there that I'm a little concerned about how it was written. Other than that, almost the rest of it's the same as was in your policy, except for the universal precautions part was added. I added.
All right. So why don't you discuss
Does that make
it? And
sense?
then- yeah.
I'll make sure I make sense. All right. So I think the purpose is the same for the most part. The goals are the same. I think we really need to look at goal number 3. Goal number 3 says to inform students, parents / guardians, teachers, school employees, and members of the community about safe practices regarding HIV, hepatitis transmission, and the district's HIV, hepatitis policy and bloodborne pathogen exposure and control policy. The reason why I highlighted that is I am sure and not sure whether or not we have a bloodborne pathogen exposure and control policy. That has to do more with cleaning and things along those lines. That was my understanding.
Oh, really?
So that, yeah. So and I could be wrong, okay, but as I said, you start to go down a rabbit hole.
Yeah.
I could be wrong, but my understanding is there's supposed to be at every building a bloodborne control policy, exposure and control policy regarding cleaning.
Well,
under
that really wouldn't be a
standards and all that.
policy as much as a procedure. Shouldn't we just
Procedure,
have-
it would be, it's a procedure, but it is in their policy. This is exactly from the Rhode Island policy. I'm not sure if we need to have this inform, this whole number 3 in here, but I wanted to leave it up to you all for discussion.
Pleasure of the committee. Or anyone else.
So I'm reading through it again, and I'm just wondering, what are we informing parents and teachers about? What are well, parents and guardians about?
Yep.
What are we, if it's a procedure, is that really?
So they're in this particular thing, they're saying the safe practices regarding HIV and blood pathogens. Further on, it talks about how to educate the community, which I'm not exactly sure anyone's doing really anymore because we've been living with HIV and AIDS for so long. So that's another component that I highlighted that we might want to think about. We do educate students in virus and virus protection as well as universal precautions, and it's part of the health curriculum. That part is absolutely being done, but we don't do parent information or community information regarding that. So I think this is, my opinion is, I think this is okay if we just, well, I highlighted it because that bloodborne pathogen exposure and control policy, because I was a little bit concerned that we may not have that. Other than that, it's just that we're informing people that we have this policy and we use universal precautions. That's how I read it.
Do we need
My
it?
opinion
Yeah.
is I would nix that.
I don't think we need it, but
I don't
that's,
think we need it.
Right, I don't think that it's needed as well.
Okay,
That's
you want
why
to
I
get rid of that
highlight
whole
it.
paragraph?
yeah, that's,
Yeah.
I didn't think you needed it, but I didn't want, it's not my decision. We need, we need to think about it. It just seemed a little redundant
Mhm.
or a little
Yeah.
bit awkward at the same
Okay.
time.
I agree.
I wouldn't be surprised that within the next year, all of the guidance on this kind of stuff with everything else going on
Yeah.
will probably end up getting changed or modified or whatever.
And I'm sure they haven't really addressed this one since I think the last time this one was amended was 2012. So it's been a long time. But
Yeah, this
I
policy's
think
from 13.
yeah, so I think it's a good idea that we at least amend it to get it updated, right? So then if we have to do another update, it's not as much.
All right, so
It's up to you
we'll
all.
start with removing item 3.
Okay.
Is that,
I'll
That's-
motion
Yeah.
to remove item 3.
which
I'll
means that
second.
item 4 becomes item 3.
Yep.
All right, Rachel, what else do you have?
All right, so the rest of it is, the definition is the same. The definition of
Dissemination.
hepatitis infection is the same. Routes of transmission, I thought that was odd that it was in a policy, but it's actually in the Rhode Island and RIDO policy to have that. Because again, I think their intention was to provide education, and that's one way to do it. The reporting is the same. Talks about the general laws stating that you can't reveal and confidentiality and all this, that's the same. Special around employee. This is the only thing, I think this is why it's in J11 and G4 is that you have employee and then student, but
Yeah.
it's all in the same policy. Then there's a whole section of persons who may need to know, and that's very kind of clearly defined as to requiring a release of information. I think that's fine. The next part that I had a little bit of concern was under dissemination,
Mm.
which is on page 4 of 6. So under dissemination, it states,
I'm
this
sorry,
policy,
could I interrupt for one moment?
Yeah,
I'm
please.
Terribly sorry. Mark, I believe that Carrie and I both had a motion and a second on the table that we need to close out first before we.
No, we're just gonna,
Discussion.
we'll do everything all at once on this one.
Okay, so all right, so I'll withdraw the motion that we put
Yeah.
in earlier. Okay.
Okay, so thanks for clarifying that. So under dissemination, it says this policy will be a permanent part of the bloodborne exposure and control policy available in each school building. So alert, Rachel goes alert. Do we have that? And would be distributed annually through a minimum of the following methods. Dissemination to students and parents at the beginning of each year in connection with scheduled in-service opportunity to provide both groups with relevant information regarding prevention and transmission of HIV/AIDS. So that says that every year. And so we've been in violation of the state policy, but this is that every year that we're going to meet with students and parents to talk about that. We don't do that. Posting in a conspicuous place in each school and school administration building. Well, it's posted online in our policy, but not on the wall anywhere. Inclusion in school committee parent and student handbooks. It is true. It is in our policy. It is also in the student handbook. So that one's fine. Posting in all faculty rooms. No, we haven't done that. Dissemination to officials of a collective bargaining unit. It depends on how you define that. If by the fact that we have the policy is considered dissemination, then we have it. If you define that differently, we don't. Dissemination in service to meet the needs of those parents whose language is other than English, and inclusion in staff in-service training programs for all members of the school committee, including professionals, support staff, coaches, bus personnel, building maintenance, and all others. I'm not quite sure if we do that either. Again, it's a different time, right?
Yeah.
So.
Does anybody
I
do
thought
that?
none of the districts I've worked in ever did that. We do universal precautions, which is the next section, but not this. This is dissemination of HIV educational information. We don't really do that. So I thought I would propose that we just eliminate that whole section. But again, it's part of the policy and I wanted to make sure you all knew.
Yeah,
I would
because
think
I
the
mean, some of
universal-
this
yeah,
stuff,
sorry, go on.
I mean, a lot of this stuff, first of all, anything can be translated to any language as we need to. That's just like a standing procedure within the district. Yeah, I can't, unless if somebody has any objection, I would say we should just remove the whole section.
It just seemed
I think-
odd.
Yeah, I think universal precautions typically would cover that. I read through those as well.
Yeah. I'd agree.
So yeah, I don't have any objections to removing it.
So I felt like by adding the universal precaution, I agree, exactly what you said, Carrie. That's why I added that whole universal. I just thought it was glaring that it wasn't in the policy. I thought it was odd. Because it is part of the same document that the policy was kind of pulled from, included universal. So we'll eliminate that whole dissemination section, which I think, again, weird.
Okay, so if somebody wants to make the motion for those two things, that'd be great.
The removal of the one we just spoke of and the removal of.
Yeah,
item-
just to clarify, it would be the removal of under goals, number 3. And then we would also change 4 to number 3. And we would delete dissemination, that entire section.
I'll make a motion on both.
Okay.
I will. Second.
All in
And
favor?
then the only other thing is the addition of the universal precaution section, Mark. Which
Oh,
comes
that's
directly
new.
from the policy. That's an
That's
addition.
supposed to be red.
Yeah. So, you want me to read it?
That's what I'm
Yes.
at.
Here we go. Universal
Oh,
precaution.
wait. So let's take a vote on the amendment first. All in favor?
Aye.
Aye.
So that passes 3-0, and then go ahead, Dr.
Okay.
Thompson.
So universal precautions and the provision of supplies necessary for implementing them represent the district/school's commitment to safety and prevention. Universal precautions are to be taught annually to all staff. We do that. The necessary supplies for implementing universal precautions should be available and current. We have a lot of them right now. You probably
Yeah.
read my commentary, but that's sort of what I'm thinking. The key to understanding implementing universal precaution is to treat all visible blood and body fluids as potentially contaminated, including clothing and services. 7 procedures are necessary for the implementation of universal precautions. 1, disposable gloves should be worn whenever a person finds himself or herself in a position where they could be touching any other person's blood, body fluids, or contaminated clothing. 2, washing hands and skin is the single most effective health precaution for all viral and bacterial exposure. 3, properly cover all wounds, cuts, oozing, sores, rashes, etc. This is so pleasant.
This is a disgusting policy.
Mm.
4, use the Environmental Protection Agency registered disinfectant to clean up blood, bodily fluid spills, and/or surfaces in accordance with manufacturer's recommendations. We also do that. Clothes soiled with blood, vomit, urine, or fecal matter should be handled while wearing disposable protective gloves and placed in disposable leak-proof red-colored waste liner that is permanently labeled biohazard waste and permanently labeled with the universal symbol and prepared to be transported home. 6, avoid accidental needle sticks. Needles are not to be recapped. And 7, needles and other potentially contaminated sharp items shall be discarded in a puncture-resistant container or sharp disposal container.
And every nurse's office has those.
Yeah, they all
containers.
have that, right,
Yeah.
right. And then the last part of that is the bloodborne disease education. Cumberland School Department will provide, this is actually part of the original policy.
Okay.
So I kept that, and that's true. I double checked with Donna. We worked on this a little bit.
Just for future reference, I'd prefer everything to be in red, all changes in
Okay,
red.
yep.
And if you want to delete something, just red line it also. This way it stands out much better.
I'll try to figure out how to do that in on Google Word, Google Docs. I know how to do it in Word, but not necessarily Google.
No,
Docs.
do everything in Microsoft. No, I use everything goes through Microsoft Word for me.
Okay.
So, all right. So that part is going to stay the same. We have the amendment that we voted on. So I would ask to approve the amended policy. A motion for that.
I would motion to approve the amended policy.
All right. Where am I? Hang on. I'm just making my notes so that when I do the minutes, I actually know what's going on.
I will second on that.
And you'll second,
I
and
will, thank you.
all in favor?
Aye.
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 And just so you know, I mean, what'll happen is these changes will be made. They'll be placed into the folder for Thursday's meeting, and then as the entire committee will vote to actually pass it.
I'll
Next-
make these changes, Mark, and get it to Cindy.
Okay, thank you.
Yep.
Next up,
So I prepared the changes if you want to quickly look at them super
Sure.
quick on the other one. Mike, can I share my screen or no?
Should be all set.
Right, hang on.
this is so much easier doing it actually in person.
I know. All right. So this is the language that was changed. It reads as I edited it. And I underlined the additions. So we read it. Do you want me to read through it again?
I think everybody can read it, right?
I can read it.
Yeah, and there's really no need to mention the virtual academy at all.
That's a different beast.
Yeah, altogether. I mean,
This is good. Thank you for that, Catherine.
My
Katie.
pleasure.
all right. So we just need a motion. I mean, we have the motion, we have the second. We just need the final vote to approve it. All in favor?
Aye.
Aye. 3-0. Excellent. Next up is discussion and or vote to delete policy J10, tuberculosis. Dr. Santos.
So again, I researched this, and we actually had a little moment in HR saying we haven't been requesting this. Then we realized it's because it was eliminated in 2012. So
Oh,
I
okay.
clarified that and talked to the Department of Health. It's no longer required. The only time it's required is with very specific populations of patients and nursing care, or medical care, I should say. So this is we shouldn't have this policy any longer. And by the
Well,
way,
there's
they're
an
not
interesting
following
question,
it.
because do we need to make sure that our nurses,
They know.
no, I mean, do the nurses have to be checked for tuberculosis? Do we need a
It
policy for that?
No, because that depends, it has nothing to do with school. That is if they're working in like how it's put to
Hospital,
me is if they're
nursing.
working like a subacute population of patients that have the potential of being contagious for tuberculosis. I think is how Department of Health worded it when I asked them. But it's not required of schools. It's not required of staff anymore. It's not required by students. So it's really a policy we shouldn't have anymore. It's completely antiquated.
Yeah. And it's in the wrong section. All right, so we just need a motion and a vote to delete the policy.
I'll motion to delete the policy.
Okay.
Cleaning house. I will, I will second it.
Excellent. All in favor?
Aye.
Aye. That's like a personal triumph for me.
It's
trying to do, Rachel, we've been trying to do this
on
for
our
what,
list
about
for
a year?
A year.
Yeah.
It's been on our list for a year. I actually had it on to-do list. And he's like, do you remember we talked about? So yeah, I actually do. I had a whole note about all the things we wanted to review. And that was one of them. It was actually the easiest one, except for it went down this other rabbit hole, which leads to the next
Right.
policy.
So that's a nice segue into discussion of new policy,
Yeah.
item A, the immunization policy.
So
Which
a
doesn't
little
have
bit.
a letter, but this is really just discussion at this point, Dr. Santa.
Right. So I did draft one. This is again, I never write them. I compile them and essentially in some places completely copy from the already existing policies that exist in the state. So when I went down the tuberculosis rabbit hole, found out that we did not have an immunization policy. We're following the state regulations, but we didn't actually have a policy. So I went and just kind of spot checked other districts, and all those districts had immunization policies, and realized that maybe we should take from the document I talk about, the rules and regulations pertaining to immunization of communicable disease testing in preschool, school, colleges, or universities that's required under the Rhode Island General Law, that maybe we should apply this. So what I did is I went into these laws, into this actual document, and I pulled out the stuff that is pertaining to school. It was like in one little section. So things like the minimum standards for immunization. In the actual rules and regulations, they actually delineate all the immunizations that are currently required. But I felt like that could change at any particular time, and that in our best interest, it would just say the ones on how they determine what immunizations are done, which is through the Advisory Committee on Immunization Practices and the American Academy of Pediatrics and the American Academy of Family Physicians are the three agencies the state uses to determine the immunization schedule, which is probably nationwide, but definitely for Rhode Island. So I figured instead of us delineating those, it didn't make sense. Rather go by what those recommendations are, which could change from year to year. We don't know. The next section, I described what is considered to be an immunization record. They're very specific as to what that could be, but there are choices. It doesn't have to be just one like particular document. That's that section. I thought it would be really important to include number 6 under there, which talks about telephone confirmation by the school of existence of immunization records as defined above, provided all the following conditions are met. That was very clearly, excuse me, in the regulation. And I do know that our school nurses, it's not COVID, I have a tickle.
It's like I want to like lights all the
clarify.
screen right now.
Woo. Okay. That I do know some of our school nurses are in telephone communication regarding records, and I thought it'd be important to have this in policy. Sorry. And then the piece regarding exclusion. Sorry about that.
Doesn't look like you're
Exclusion
going
from
into the
school.
building tomorrow.
Yeah, this is all an act, so I can be quarantined tomorrow. No,
I need documentation.
okay, no problem. No, just kidding. I'd rather go in. It's crazy around here with the kids and dogs. And anyways, the next part talks about exclusion from school and what are the conditions, only conditions that would meet that criteria. And then the last part is about, or no, second to last part is about waiting period in school enrollment. That's important because of how long you're allowed to say that we can accept the enrollment of the child or enrollment in that next school, but that not necessarily not have the record yet. There are certain waiting periods that might have to follow through. And then there are different requirements regarding kids on that are DCYF where we have to accept the intra-state card as well as immunization record. And then the last component just talks about the exemptions, who can be exempt. So that's right from that document I referred to with all the components related to school. Thoughts, feelings, concerns?
So first of all, I think this is awesome, and definitely needed. The second thing is just to like not open a can of worms, but is this only just kind of a, well, it's the pediatrics. It's not the Rhode Island immunization schedule, right? It's the you guys know what I'm getting at, right?
That's exactly my question as well, Carrie. That is the only
Yeah,
question I had.
people might push back on us because of HPV and that vaccination, but I think that by putting it in these general terms and saying that it's the, you know, the overarching what's recommended by those groups. Sorry, that's where the document is. So I'm like,
Yeah.
by those
Yeah.
groups, you know, I think that avoids it, but I just wanted to bring it up.
That's exactly why I didn't include all those little components. I also frankly think that if there's anything having to do with COVID immunization or vaccination, I didn't want to touch that really,
Yeah.
that we're only going with what the recommendations are and the fact that they could be changed, right? So that's why I left. I didn't feel that was necessary because it all fell underneath the section talking about, let's say, minimum standards. And then it talked about in more detail, but I didn't feel that our school policy need to do that. That's not really our decision, what gets immunized and what doesn't. There is a particular thing that I thought might be helpful depending on what happens with COVID and people's concerns about that vaccination. When you look at the exemptions, let me make sure, I think it was an exemption section. No, it's in, it's under exclusionary factors. A student may be excluded from school under any of the following conditions. All right, number 3 says, and this is already current, this is not, I mean, this is probably from 2000, I think 2014, so, or 14, 15, so it's kind of old, but it says, the presence of vaccine preventable disease outbreak is determined in consultation with the Department of Health. If an outbreak of vaccine preventable disease should requirements. So those are exemptions, those 2 things that could happen either for medical reasons or for religious reasons. Described below shall be excluded from school by the administrative head of school for a period of time as determined by the Department of Health based on a case-by-case analysis of public health risk. So I think that might be an important part of our policy in case there's anything that comes down the line with COVID. I don't know if there will be, but I thought that sort of protected us a little bit from that component too.
I like the
Yeah, I know
wording
that's
though.
been mentioned in other states.
Yeah.
Yeah.
Yeah, so I thought, again, part of the thinking, again, it's a rabbit hole thing that happens is that there may be something comes down the line COVID, there may not. We don't have this policy, we probably should. And if there is something that comes down the line, at least we have something to start with and not having to start all the way from step 1. Because then it
Okay.
feels reactionary versus
Right.
just part of policy review, do you know?
Yeah, and I like getting things done before there's a furor over it. So, Mrs. Feather, Mrs. Smith, any thoughts on this?
Now, my only thought again is Rhode Island and what Rhode Island requires may sometimes differ. So I don't know where that would put us legally. I mean, do we have to say it's based upon the Rhode Island regulations, or can we say all the others as Dr. Santa had listed?
Mrs. Duncanson, you're the lawyer in the room. Would you like to weigh in on this at all?
I would have to look into,
Sure.
really. I can't really answer that for sure right now. I think if you follow the Rhode Island regulations, you're covered.
Well, I think that Kerry brought it up as well. The HPV, I think, is mandatory in Rhode Island. However, it's not mandatory in all states.
No.
Yeah.
It's on the suggested list, and that's the one that I can see be quite a problem, because a lot in the state has been argued on both sides for it.
Yep.
But if it's removed from the list, we could remove it from the policy.
Yeah,
So
we should look at what other districts have,
Who they referenced.
yeah, I don't know.
They don't reference specific immunizations. They just
Yeah.
reference, I thought I added, or the component from the regulation I kept it or put in here was where that schedule of immunizations came from, where it
Yeah.
says recommended childhood. Because I thought that was important, that they saw that it was from more than one source. We don't have to have that. I'm putting out there. I just thought that seemed kind of.
I would agree
cohesive.
personally that I like that better, but
Yeah.
I just didn't know legally if we have to be concerned if we're not taking Rhode Island over anything else, like just Rhode Island regulations supersede anything.
ultimately, you can't deny a child entrance if they've complied with the regulations of, like, you can have all the policy in the world that it differs, but if they comply with what Rhode Island regulations and laws say for enrollment, then you have to take them.
What happens with kids from other states, like the DCYF kids? Are they just not subject to our regulations, like the HPV?
My
Thinking of the
understanding.
weird case that we've had just recently with DCYF, with the Fall River or whatever, whatever.
No, there's a student that was here that went to Fall River, but we had
Oh,
to
if
transport
it
him. It was a
was
different
reversed though,
case.
what would happen
So
then?
I think the majority of the recommended list comes from the same list. So most states go by that. And I think it currently says in state, yes, I saw it said 2 doses of HPV vaccine was the last one that was added. But I don't believe, we never have exempted or excluded a kid from school from not having the HPV. Because ultimately it's not necessarily atypically communicably just communicable disease that would be passed along, like chickenpox or these other things that could happen. So,
Right, it's not viral.
and there are exemption. I mean, you can get exemptions from that. I don't think, again, and Katie, correct me if I'm wrong, I don't think we can decide whether or not we're going to follow the Rhode Island general law or not the Rhode Island general law. We can't do that because it's not our law to fix or amend.
Right.
But we could talk. I mean, that's where the policy comes from, of why we even require immunizations in school. So I did think it was important to quote where it comes from, because it is required. I mean, required for that. I do think the recommended schedule, I liked that wording, because that is how they worded it, and that's what it's titled, is important. I don't know. I'm not sure what will happen. I don't know if ultimately the general law is going to be changed over the HPV section or not. I don't know.
Yeah. All right. So what we'll do is we'll bring this up in 2 weeks to actually vote on it. And
Okay.
if you guys find, or if Katie or Rachel find anything different, we can update it
Yeah.
before then. So
I'll call Rido again about that, because
yeah,
we're finding some things that are still existing that don't exist, just little odd things like that, like the tuberculosis thing was one of them. But I didn't talk to them about HPV or anything like that. So it's possible that there might be another amended document that I didn't see. I can ask. Who
Okay.
knows?
Okay.
That wouldn't
Next up
necessarily
is-
change our policy, but would change what was required, right?
right. Next up is a consideration of policies to create or review for future agendas. This is something that I worked with. This is an item that I actually worked with Steve Adams on, just to try to get around open meetings violations of being able to have a discussion about what we want to, review or look at for possible new or amending current policies for the future. Because without this line item, we'd be doing it behind closed doors, which really just flies in the face of the OMA. Does anybody have anything that they'd like to consider for the future, or any policies that they've looked at that they're concerned about that they'd like to discuss in the future? That includes admin.
Mark,
Mr. Devon.
may I?
So the middle school team and I and my team were working on the potential for changing over and making some adjustments to the middle school grading system. If you remember, a
Yes.
while back, we started a district-wide grading system shift. So the middle school has been working really hard, and obviously Jay's on the call, so if he wants to interject, he can feel free to. But we're in the midst of figuring out whether or not we could execute this for the beginning and have a readiness for the beginning of the school year. We're going to reevaluate in April, but the reason why we haven't, COVID struck, so it interrupted the work, and in order to really complete that work, you've got to have teachers involved in that, understanding it's an overview of the assessment system, the rubric system. So it's quite a bit of work. Where we think we can launch in September. So if that's the case, we're going to have to start to review the policy and make some adjustments and changes. I don't know, Jay, if you want to add to that, but that may be something on the horizon.
Yeah, just to add to it, logistically, it's important, and Mike's going to help us out with this. Any changes to Aspen like this, we have to get those in by like March for the next school year. So it would be better for us if we can get this policy done faster than as fast as possible.
Okay.
Mike, that's true, right, Mike?
Yeah, so we can have a preliminary discussion around some of the things that you're thinking about. And then we'll have a better determination of how long the customization will be. Some of the things that we did at the high school, we're able to get done faster. If there's any drastic changes, then it just may take a little bit longer. So either way, we should be able to, work our way through it, I hope.
It should be a much simpler system than the high school was, Mike, so.
Perfect.
Excellent. Yeah, just let me know, Mr. D'Amato. And if you need me to sit in on anything during the day, just let me know. I know we talked about that the last time. Anyone else? Mrs. St. Jean, anything that you'd like to bring up? Mrs. Duncanson.
So we are going to have to look at the G6. I know that comes up, I've been told, pretty regularly. Right now with the
Excuse me, I
salaries
just want
are
to stop you for a second. G6 is the policy that
personnel.
basically talks about all of the non-union workforce, all the contracted workforce.
Thank you.
Right. So the salaries, the salary ranges need to be adjusted to comply with what we are contracted right now and future. So we will need to look at that. Plus, we've added the Department of or the Director of Facilities since that happened. So.
Okay. Anything else?
One last thing, Mark, and we can talk about this further, but the Department of Ed is requiring that districts comply with high quality curriculum, whatever
What does
that
that
means. We're trying to figure that out. They're approving specific curricula through an organization called Ed Reports.
Oh, right.
Yeah, so we're going to have to look at the policy and make sure that maybe our policy includes some language that supports what RIDE is asking us to do in terms of timelines and making sure that we have to have certain curricula in place by 2023 and 2025. So we can talk about that. That may be something that has to come up.
Yeah, we don't expect that to be a problem as far as our choices of curriculum, really, do we?
The way that we language the policy, I'd have to double check on it. I mean, there was more sort of internal control on certain things, and there were certain aspects and language in there that may have to shift a little bit, with RIDE having a little bit more say in that. And right now, we don't have anything in those policies that sort of suggest that.
All right.
All right.
Anyone else? No. Next up, public comment. There's nobody from the public. Mrs. St. Jean. In that case, I just need a motion to adjourn.
I'll motion to adjourn. I'll second.
Who's the second?
Ms. Smith is the second.
Ms.
Mrs.
Smith.
Feathers the first. Yeah, she motioned.
Excellent. All in favor?
Aye.
Aye. We stand adjourned at 6:25 PM. Thank you very much. This was a very gross meeting. Thank you, Dr. Santa, wherever you are. So.
Sorry, here I am.
Thank you. I'm glad that it was
My
before
dad has
dinner.
called me like 5 times in a row, so I was like, I better answer it. He
Oh.
wanted to sing an interesting rendition of Happy Birthday.
Nice. Well, happy
Happy
birthday. Enjoy
birthday.
the rest of it.
Happy
Thank you,
birthday.
everyone.
Happy
Thank you.
birthday.